Rob wants his life back, and for that he needs 2 knee replacements. He was due to have the first one in March, but that was cancelled because of coronavirus. Then in June, he got a letter with bad news.
I haven't got a replacement date come through yet. I have, on the other hand, been told it won't be happening this year. I've been living in hope every day, every week, since I got informed it was cancelled in March. And I really thought, you know, things will shortly get back to normal eventually. It's going to have to happen because I was so close to having it done. That hearing that has actually set me back big time in the last 48 hours.
Rob's one of millions on the NHS waiting list, which is growing so fast it could be at 10 million by Christmas. To tackle it, we've learned that hospitals are turning to companies which use algorithms to prioritise patients automatically.
We developed a digital tool which was designed by clinicians alongside our digital staff, of digital questionnaires which could be completed by patients at home on their smartphone or their laptop instead of a face-to-face appointment, which then could be, the answer could be reviewed by doctors or nurses in a clinic to determine actually did that patient need to come to hospital, or are they safe to continue at home with their, for example, their cancer treatment without needing to come to hospital.
Tom says that if every hospital used his tool, they could cut the time it would take to get through the backlog from 4 years to 10 months.
There's a huge opportunity to use technology to make sure that we're only seeing sick people in hospital. Everybody else can stay at home, get video consultations, get risk stratified, get remote care so they're seen when they've seen it. That allows us to quickly work through by prioritising those patients based on risk, not time.
Yet even though there's always a doctor involved, there are still questions over how much we should trust these systems.
We know a lot already about how bias feeds into algorithmic systems and makes the outcomes of those systems often discriminatory in effect.
Rob says he doesn't want a computer deciding his fate, but there's no doubt about the severity of his pain. And with time in desperately short supply, every intervention could make a difference. Roland Manthorpe, Sky News.